The Honourable Leader of the New Democratic Party.
Thank you. My question is for the Premier. Mr. Speaker, the evidence is becoming more and more clear that addressing the housing crisis is so vital to improving actually the health care of the people of the province. Now, recently, writing about a comprehensive review of studies about how health is impacted by housing, the Mental Health Commission of Canada wrote this: "Spending a large proportion of income on housing affects health," unquote. So will the Premier agree that having 20% of our renters paying 50% or more of their income for their shelter is simply having a very negative effect on the health and the health care of the people of our province?
The Honourable Premier.
Thank you, Mr. Speaker. And the member raises an important issue. This is the determinants of health. We're all familiar with that. There's a number of them, and they're all important, including access to shelter. But what I would say is, if you look at the way we've structured this government, I'm very pleased. We have the first minister for addictions and mental health. We're focused on addictions and mental health. We're focused on housing. We're focused on healthcare. We're focused on a number of things, and we have a lot of work to do. There's no question about that. I ask the member to join us in trying to get that work done in a productive way.
I would ask the Leader of the New Democratic Party to table that quote that he provided before. The Leader of the New Democratic Party on his final supplementary.
I believe it's the first supplementary, perhaps,
First
Mr. Speaker?
supplementary, I'm sorry. Yeah.
Mr. Speaker, hundreds of individuals and dozens of organizations around the province have just lately written an open letter to the Premier under this heading. It's titled "Housing is Health." This includes a wide variety of organizations: the Family Services Association of the western part of the province, the Community Health Board in Cape Breton, the Truro Homeless Outreach Society, the College of Social Workers for the whole province. And the letter asks, among other things, for the Premier to institute permanent rent control. And the letter says, "We call on you to accept that housing is a human right and that housing is health." So will the Premier agree with the hundreds of signatories to this letter that the government can't actually fix health care without protecting people's right to not be priced out of their homes? And I will table that document. Thank you.
The Honourable Premier.
There are lots of moving parts to this issue. There's no question. I have tremendous respect for the organizations that penned that letter. They do incredible work in their communities, and I thank them for that. And working with government, or our government will certainly work with them to get what we can done. But certainly, there's no dispute on whether there's a housing crisis. There's no dispute that it's been brewing for quite some time. And I also think there should be no dispute that there are multiple parts to solving the housing crisis. One of them is supply, for sure. We may not agree that more supply is necessary to fix the issue, but I certainly believe there is. We'll put forward a plan in the coming days, and it will include a number of things. Thank you, Mr. Speaker.
The Honourable Leader of the ADP on his final supplementary.
Mr. Speaker, this is the mother of all red herrings. There is not a single person in this House, or that I know, in Halifax or Nova Scotia, who doesn't think that supply is important. Let's be clear about that, please. Now, the Affordable Housing Association, whose document I'll also table, conducted some time ago a survey of people experiencing homelessness in this city. They found that around 3/4 of the people they surveyed had in the recent past been to an emergency room, and about 4 in 10 of them had been hospitalized during that same period. So will the Premier acknowledge that the government can't effectively advance a health care agenda without seriously addressing homelessness in this province?
The Honourable Premier.
I agree these things go hand in hand. There's no question about that. They certainly do go hand in hand. The determinants of health are something that we're very focused on, and we remain focused on. So look, we'll put forward a plan. It'll have many moving parts because the issue is complex, for sure. But we understand that. We want to make sure that the plan we put forward works for Nova Scotians and actually make sure that people can access the shelter that they need. That's what our focus is. That's what we're striving towards. Thank you, Mr. Speaker.